This lecture examines how certain advanced astrological techniques have been used symbolically in the study of psychological themes. It is not medical advice, not a diagnostic method, and not a substitute for professional mental health care. Astrology is a symbolic language. Mental illness is a clinical reality that requires trained clinicians, evidence-based treatment, and compassionate support. Anyone experiencing psychological distress should seek qualified help. Within the astrological tradition, practitioners have long paid attention to configurations involving the Moon, Mercury, Saturn, Neptune, Pluto, and Chiron when discussing emotional regulation, thought patterns, and states of suffering. Midpoints are one precise tool. The Moon-Saturn midpoint is often read as emotional restriction or a sense of inner heaviness. Moon-Neptune can describe porous boundaries and difficulty distinguishing inner and outer reality. Mercury-Pluto may indicate obsessive or penetrating thought. Saturn-Neptune can correlate with chronic doubt or the feeling that structures dissolve. These are symbolic descriptions, not diagnoses. Secondary progressions move the natal chart forward roughly 1 day per year of life. A progressed moon entering a challenging aspect to natal Saturn or Neptune is sometimes observed during periods of heightened emotional difficulty. Progressed Mercury stations or hard aspects to outer planets have been noted in times of mental strain. Again, these are correlations reported in astrological literature, not proven causes. Annual perfections advance the ascendant 1 sign per year. When the perfected ascendant lands in the 6th, 8th, or 12th sign from the natal ascendant, or activates the rulers of those houses, some traditional authors note a greater likelihood of themes involving health, crisis, or withdrawal. The technique is timing symbolism, not prediction of pathology. Decans divide each sign into 3 10-degree segments, each with its own sub-ruler. Certain decans have historically carried heavier psychological reputations in older texts. For example, the 3rd decan of Scorpio or the 2nd decan of Pisces, but modern practice treats these as colorations of expression rather than fate. Transit work follows the same caution. Outer planet transits to the Moon, Mercury, or the angles can coincide with periods of intense inner pressure. The astrologer's task is to help the client understand the symbolic weather, not to forecast breakdown. Illustrative patterns that appear repeatedly in astrological case literature include heavy Saturn or Pluto emphasis on the Moon or Mercury, repeated activation of the 12th house, and clusters of midpoints involving the outer planets with personal points. Yet for every chart that fits a difficult pattern, there are individuals with similar charts who remain resilient, and individuals with mild charts who struggle. The chart is never the person. Responsible practice therefore holds 2 truths at once. First, the symbolic language of midpoints, progressions, perfections, and decans can offer meaningful language for inner experience. Second, that language must never replace clinical assessment, therapy, medication when needed, or the simple human support of community. Precision in technique is valuable. Humility about its limits is essential. In practical consultation, the most useful stance is collaborative. The astrologer can help a client name recurring emotional weather patterns. Notice when certain progressed or perfected periods have historically felt heavier, and prepare supportive strategies in advance of known difficult transits. None of this replaces a psychiatrist or therapist. It can, however, sit alongside clinical care as one additional language of self-understanding. Case-style illustrations in the literature often show a natal moon under heavy Saturn or Pluto pressure, or a Mercury tightly bound to Neptune or Pluto, activated by a major progression or outer planet transit at the time of crisis. The same literature also contains many examples of nearly identical configurations in people who never experienced clinical-level distress. Selection bias is real. Astrologers see the charts of those who seek them. Therefore, the ethical rule is simple. Use the techniques to increase insight and timing awareness. Never use them to label, frighten, or discourage a client from seeking medical help. When in doubt, refer outward. The sky is wide. The duty of care is wider.